Right now, you're probably getting data and observations from field medical notes, publications, patient registries, and other swaths of data that your team has access to today. However, that data is oftentimes complex, messy, unstructured, time-consuming, and difficult to analyze. So how do you know which insights, what data points to prioritize? Is that N of 1 insight that you see in an MSL field node actually going to be the opportunity that unlocks medical impact on patients or your business strategy? Does your team have to continuously go through spreadsheets, right? Or pull all of this data from different sources to compile a report, a presentation, a PDF to then share with the rest of the team? All of that is ultimately really time consuming to do. If this sounds familiar, you're not alone. Many teams operate off of spreadsheets trying to sift through volumes of data to really find out what are those core insights. But unfortunately, no one's got the time, right? So how we're all busy, we're trying to engage with KOLs, we're trying to figure out what are the discrepancies in the treatment guidelines. Like, how are you supposed to know? So there are 3 key reasons why your team might not be getting the certainty they want from their data. So reason number 1 is that your team is not aligned on the core questions potentially to be asking, whether that's when field medical is at a congress or engaging with HCPs or doing research on publications and doing a gap analysis. With that, oftentimes comes the fact that people have different definitions of what an insight is. So is your team aligned on the same definition of an insight being at the intersection of business impact, stakeholder need, like what do HCPs need, what do payers need, as well as ultimately what we're all in it for, which is patient impact. So the second key reason that you might not be getting the quality of insights from your data that you'd like is you're not looking at more than one data source to gather evidence to validate those N of 1 or potentially N of 2 insights. So typically what we see with medical affairs teams is that the insight comes out of field medical. An MSL has a conversation with an HCP, an interesting qualitative insight comes out of that. But then the question really becomes, do I prioritize it? How do I know this insight is important? And oftentimes, teams might not have the time or the capacity to look at other data sources to gather evidence to support whether that N of 1 or N of 2 insight is super critical to the team. This could mean looking at the call center and seeing if you've had similar requests. This could mean looking at the latest Congress abstracts or publications. This could also mean sharing those N of 1 insights from one MSL regionally across with other MSLs to see if there's more evidence that is coming across all of your data sources to help determine whether this insight or opportunity is worth prioritizing. And the reason why this oftentimes doesn't happen is just it's time consuming. Unless you have the right data infrastructure in place to automate a lot of this insights gathering and kind of unifying the data and then being able to correlate those different signals you're getting and find the patterns, it's very time consuming to do. The third reason why we see teams not get the full value out of all of their data is that they are stuck in spreadsheets, or they have to work through really complex analytics flows to even get insights. Or maybe their notes are stored in a notebook, right? So collating and unifying these different insights into one place for analysis is oftentimes very time consuming. It's also oftentimes done manually. You might hire consultants to go through the spreadsheets, label all of that data, put it together in a report. But the problem with that is that it takes a really long time to do that. Oftentimes, especially depending on how quickly you need to move, by the time you actually get that insight, it can be outdated. And furthermore, that process just isn't automated. So it takes time away from doing other critical field work or critical medcoms work or med info work, etc. Now that we've covered the top 3 reasons why most medical affairs teams we see today aren't really extracting the full value of their data to get those insights to adapt their medical strategy, the question is, how can you actually start going through and addressing some of these? So I think the first really important thing to do, and this is a conversation I've had many times and I've gotten different responses for this, But it's important to define like what is an insight. And typically what people get wrong is when folks hear the word insight, they assume field insights. And field medical is the lifeblood of medical affairs. They get really amazing qualitative deep insights through the relationships they build with KOLs, with clinical trial sites, with payers, with patient advocacy groups. So important. But insights is not just field medical. Insights, for our definition, and I'm going to pull it up here, but it's a new trend or pattern coming from a single or a collection of DFOs, data, facts, observations, that unlocks a new understanding for a team or a company. It's typically in the context, this is important, in the context of a North Star KPI, combining unmet medical needs of the patient with business objectives. And an insight itself isn't actionable unless it can do one of these couple of things. Either A, it identifies a gap to close. It could be an informational gap, evidence gap, formulation gap. It could be a content gap of some sort. 2, it identifies a new opportunity to explore. So this could be a new indication, a new study population, a new mechanism of action, new channel, new content, etc. 3, it confirms or validates pre-existing views of hypotheses where appropriate. Or lastly, is actionable internally or externally if it doesn't confirm or validate pre-existing views. So this is the broad definition that I've come up with in working with medical affairs teams. If you have any sort of thoughts or feedback, I think as an industry, we all need to align broadly on this topic. Feel free to DM me, ping me a note. Always happy to adjust and have a conversation or a friendly debate on that topic. But ultimately, without these elements, insights are just data points, ultimately without a narrative. So now that we have aligned, if we hypothetically agree that more broadly speaking, this is an accurate definition of an insight, so then how do we start to now derive more value from all of the data? So step 1, and all of you already know this, and you already do this, but if you don't have a consistent process around it, I think that's the thing to establish here, is 1, align the team with key critical questions, if it's field medical, to ask when they're engaging with HCPs, and make sure that they understand the business objectives. What is the information, right, that they need to gather around patient outcomes, unmet medical needs, access, formulations, etc. So the team is aware what they need to focus when they go in, and they know what to track in terms of responses when they're having those conversations. So step 2 is ultimately aligning on, depending on your business objectives, what are the channels you want to focus on. Field medical is always an important channel. That's kind of a given. But outside of that, what are other channels that are impactful? Is it publications? Is it attending congresses? Is it having your content on a MedInfo website? Is it getting a better content out in call centers because that's how HCPs prefer to get information for your brand, your team, your therapeutic area? For example, you might choose to prioritize more resources and insights gathering with field medical, especially if you're in rare disease, right? That's very high touch. There isn't a lot of typically KOLs in those spaces, and neither a lot of patients. So deploying a field force, that being a priority and prioritizing that channel makes sense. But maybe you're in a broader therapeutic area like diabetes, and maybe there's so many doctors, they prefer to be educated in different ways. So it could be through social, it could be through having appropriate e-detailing on your website, right? So which channels are going to be the priorities? And the reason why this sounds so obvious, and I know you guys are probably already doing this because you're watching this video, so you care about this topic, which means that you're probably already a top performing medical affairs team. But it's important to prioritize those channels so that way you know what data collection to prioritize, so that way you can extract the most valuable insights. Once you have established those core channels that you want to focus on, the third step, and this is the most critical step for continued long-term success, is that you want to establish a foundation of data gathering across those channels. And you might already have elements of this in place, in which case you want to review and make sure that you're collecting all of the data that you want across those channels, right? For field medical, it could be asking those right questions every quarter. For website, it could be click-throughs. Are they looking at certain content, right? Email, call centers, what type of information is requested, call center transcripts, analyzing the sentiment of that, right? Analyzing the topical areas and how those conversations go. So just do a review in terms of, are you collecting all of the data? Because you can collect all the data and then filter signal through noise. It's always better to collect more than less. So once you have that foundation established, and if you're not measuring, that's step one. Just start measuring anything that you can across all channels. And then you can start to create a framework around how to be able to evaluate the data that you're getting. So once you're there, what you want to make sure is that you set up a review system on a monthly cadence, quarterly cadence. Honestly, I think bi-weekly to monthly is best, especially if you're talking about managing multiple channels where you're getting a lot of different data points. You want to set up ideally analytics dashboards or automate a lot of that analytics into some sort of unified place where you can see that all together, so you can start to notice trends and patterns. So you can start to see someone kept calling about side effects for a cardiovascular comorbidity for your treatment, and then also you're seeing field medical start to have a lot of the HCPs they're engaging with are also bringing up that as an issue, which means that, well, those two are combined, and now you have strong evidence for that to be something to potentially prioritize in addressing amongst a lot of other things. And the key part to ultimately all of this is to create a strong automation, a strong process. A lot of the data that comes from different sources is oftentimes unstructured. What's a field from the call center might not exactly correlate to what's input into Viva CRM, for example. So it's important to establish almost these bridges between the different data sources, so that way you're actually able to analyze that data in one view. And I promise you, once you have everyone on the team aligned on what the channel priorities are, you have a solid foundation in terms of data capture and gathering that data. And then on top of that, you're able to bring all of those different data sources into one place. You're going to be in really solid shape where you can start to see different trends in real time, different trends, different patterns that are happening, and you can address them immediately. And not only that, you can also leverage a lot of those insights to build better HCP relationships, to understand payers' needs more, right? And ultimately map out that patient journey, so that way you can, as medical affairs, as a team, make an impact across the entire end-to-end spectrum of that journey. The question I'll leave you with is this year: what can you and your team do to, depending where you are on your data journey, take that next step to improve your data capabilities so you can make more data-driven decisions to impact patients' lives? At Atrix, we're really passionate about enabling medical affairs teams to make data-driven decisions to ultimately impact patient lives and create better HCP and KOL engagements. We've helped companies in life sciences of all sizes unify all of their data internally and externally into one place to extract trends and insights in days instead of weeks or months. So if this is something that's been top of mind for you and your team in terms of how to better leverage data as well as AI, LLMs, in helping enable your team to make more data-driven insights, feel free to DM me on LinkedIn. I'm always happy to help answer any knowledge questions, be an advisor, be a guide. We have a bunch of guidebooks ranging from GPT prompts to how to think about and what we've seen work from medical affairs. So just reach out, say hello, and more than happy to be a resource when it comes to your data needs.